So good afternoon. My name's Dr. Craig Knighton. I'm one of the consultant clinical oncologists here at Northampton General. So it's important not to make assumptions about people's gender or their sexuality for a few reasons. One of them, by addressing someone with the wrong name or by misgendering them or even using the incorrect pronoun, can make patients feel disrespected. Psychologically, it can be harmful and it can even seem threatening to a gender diverse patient. Misgendering results in marginalisation, I feel, and communicates that a person's identity is not seen as important. It is important that trans patients need to disclose their gender assigned at birth on a need-to-know basis, and obviously extremely confidential, because the biological sex and gender of a patient must be considered when choosing a course of cancer therapy or treatment because of the obvious variations in body composition between males and females. It'd be lovely if I could see all patients that wish to see me. My role as a clinical oncologist is working with different subspecialties of cancer patients, particularly those with brain or thyroid or other head and neck malignancies. Obviously, patients do have the right to choose the consultant they see, but it would be inappropriate for me to see patients with, example, prostate cancer or a gynecological malignancy. I'm always happy as an advocate of the LGBTQ plus community and a member of it to wear my rainbow flag. And so therefore I'm more than happy to chat with patients if they have particular LGBTQ plus issues. But it may well be that I can't particularly design their cancer therapy for them. So it's well known that the side effects of cancer treatment are often the same, whatever your sexual orientation or your gender identity, and that it can reduce your fertility in the future. As an LGBTQ plus person, you may have some specific questions about how this will affect your sex life or your fertility options. Some people may have already made decisions about their fertility before being diagnosed with cancer. You may have decided that you don't want to have children, or you may have planned to have children in the future. What we offer for both sexes is the opportunity to have sperm stored, eggs harvested, and embryos and ovarian tissue frozen. And if you have questions about this, you must ask your clinical nurse specialist, who'll be able to give you a lot more information specific to your particular case. It might be helpful to write down some of these questions. Your team can also provide you information about fertility clinic support, and we certainly have this on our website. Macmillan also has information about cancer and fertility, and at the moment it's divided into fertility in men and fertility in women. And plan, hopefully, in the future going forward, is that it's made accessible to trans and non-binary people. There is not a lot of research about gender-affirming treatments and cancer risk, unfortunately. Some treatments may slightly increase and others maybe slightly decrease the risk of developing certain types of cancer. The most important thing is you discuss this with your gender identity specialist, and they can help explain what the particular risks are in this situation. Sometimes it's the cancer treatment itself that can affect or be affected by gender affirming treatments. And I think it's extremely important and useful that you speak to your cancer team and also contact your gender identity clinic, where you'll be given information regarding this. You might need to give them permission for us to do this. And if you haven't been seen in a gender identity clinic in the United Kingdom, your cancer team will get advice from a particular clinic if they require to. It is important for trans, non-binary and intersex people to go for cancer screening programs, examples of which include cervical and breast cancer. Cervical screening, for example, is for anyone who's been assigned female at birth who still has a cervix. People who are eligible may include transgender men, non-binary people assigned female at birth, or cisgender women. If you don't have a cervix, you do not need to attend for cervical cancer screening. These may include people assigned female at birth who have had a total or radical hysterectomy, as these involve removal of the cervix, and trans women and non-binary people assigned male at birth. Routine breast cancer screening is for anyone between the ages of 50 and 71, essentially, who have breasts, due to the estrogen produced by their body or estrogen hormone therapy. Examples may include transgender men and non-binary people assigned female at birth who have not had a bilateral mastectomy, an operation which obviously removes both breasts, or top surgery, which is bilateral mastectomy with masculine chest reconstruction. So you may be called for screening earlier if you're known to have a higher risk of breast cancer or undergo a procedure that requires ongoing observation. If you have had top surgery, it is not possible to perform a mammogram, so you should continue to monitor your chest yourself for any signs and symptoms of cancer where the breast tissue may remain. This may include areas around the nipple and the surrounding area, up to the collarbone and into the armpit. And if you've had a complete or radical mastectomy, you do not need to go for screening. If you have undergone breast reduction, it is important that you do recognise you can continue to attend for breast cancer screening. Current recommendations suggest that trans women should attend routine breast screening after 5 or more years of taking feminising hormones. Over a note about bowel screening in England, Wales, Northern Ireland, it's important that everyone aged 60 to 74 years old is invited to attend screening regardless of their gender. The programme is expanding to make it easier and accessible for everyone, and particularly between the ages of 50 to 59 years. And this is happening gradually over 4 years and started in April 2021. So it's worthwhile checking with your GP if you are eligible. Of note, in Scotland, bowel screening already starts at the age of 50 for both sexes. So whilst all staff are trained in equality, inclusivity and diversity in the United Kingdom, you may notice that some of our staff wear a rainbow pride pin badge on their uniform or their lanyard, which identifies that they've made a pledge via training to be an approachable person to talk about LGBTIQ plus matters. It is extremely important for your healthcare team not to treat you less favourably because of your sexual orientation or your gender identity. This is called discrimination and is against the law. Facing discrimination can be stressful and upsetting, and it may be especially difficult when you're already dealing with a diagnosis like cancer. If you are being treated unfairly, there are things that you can do. 1. Talk to someone from your team if it feels safe and you feel comfortable to do so. Sometimes they may not realise that there is a problem. Also, giving feedback like this may help your team make things right. Many healthcare professionals welcome feedback in a positive fashion so they can learn and offer better care. Secondly, start by talking to someone you trust. This may be a close friend or a family member or another healthcare professional you know well. Switchboard, the LGBTQ plus hotline, and the LGBT Foundation offer safe places to talk by phone or online. Gallup offers support to LGBTQ plus people who've experienced hate crime, domestic abuse or sexual violence. They also have a trans advocacy service. We have an in-house patient advocate liaison service, or the PALS team. You're more than welcome to go and see them or ring them or write to them via the email available on our intranet. Finally, you can give feedback and complaints anonymously if you don't want to be identified, and we'll give you the website for that. Finally, I'd like to make a shout out or a plea if you are LGBTQ+ and have been diagnosed with cancer and have suffered from the fallout of the treatment. If you would be interested in helping us here at Macmillan improve the Macmillan information and support across North Hampshire by please getting in contact with us and joining our steering group. Thanks for listening.